Right now, local hospitals are dealing with an early spike in RSV cases. Seattle Children's Hospital says they are seeing 20 to 30 positive cases a day, and last week's smoke made the problem worse. Across the country, nearly 75% of pediatric hospital beds are full. Joining us now for a closer look at all of this is Dr. Dawn Schifrin from the American Academy of Pediatrics. Dr. Dawn, first of all, what exactly is RSV?
Well, Christine, thanks. RSV is the most unwelcome yearly cold nose and chest virus that we have. It comes every year, usually in the midsummer, but usually around September, October. This year, it's coming back with a vengeance after 2 years of pandemic precautions have really lowered the rate that it attacked us. And it's called respiratory syncytial virus, but what I call it is a really snotty virus because it makes a huge amount of snot for colds and coughs.
You know, we think about the cold, we think about the flu, but RSV is very serious. How is it transmitted, and who in particular is most at risk?
Well, that's a great question. It's transmitted like most respiratory viruses through close contact, coughs, sneezes, and also kisses, and also youngsters who wipe their nose and then wipe it on our face as well. But it's also on contaminated surfaces. Unlike COVID, it can last up to 6 hours on surfaces and 1 hour on our hands. Highest risk are kids that are youngest because this is a lower airway disease with them. Kids less than 12 months have very small, tiny airways which get inflamed very quickly. And also the kids that are prematures, youngsters with heart and lung problems, and youngsters with immune system problems, and also youngsters with cerebral palsy who can't clear their secretions well.
And for, think about parents, and when we think about some of these symptoms, when should parents call their doctor and when should they just go straight to the ER?
Well, that's a great question, too. Again, this is a virus that usually causes a mild cough. And also in smaller children, especially those less than 1 year of age, it can inflame their lower airways and cause increased work of breathing. Parents can recognize this through fast breathing, flaring nostrils, tugging throats, pulling at their chest, or pushing with their stomach muscles, or causing grunting sounds. Now, most of these kids are very happy while they're breathing fast and they can eat well. But if your child is sluggish, if your child is now not drinking at all and getting dehydrated or has bluish lips, then that's the time where you want to call your pediatrician or go to the ER.
All right. Thank you very much, Dr. Dawn. As we head into the season, very good information. We'll talk to you next week. Thank you very much.
Bye-bye.